Hey guys, I'm Kat. I'm a rehab chiro in Austin, Texas, and today I'm going to talk about sciatica pain. Most common thing I see with sciatica is that people are constantly stretching it. The thing about nerves is that when they're irritated, they don't like to be stretched too much and they don't like to be compressed too much. So the best things that you can do when dealing with sciatica pain is find a position that is most comfortable for you. I know sometimes you do feel like you really want to find that stretch. It is so important that we make sure that we are not stretching it constantly, because sometimes while we do get that temporary relief from the stretch, we can make it more irritated after the fact. So you'll get temporary relief, but then it will just come back. So there's two common positions that people will typically go into if they are dealing with sciatica pain. The first one is going to be more of an extension position. So what we'll do is we're going to come onto our stomach here, and we're going to just prop like we're reading a book. You're going to hold this for about 30 seconds. The biggest thing that we're looking for is making sure that our symptoms are not getting worse. If I feel like my symptoms are starting to travel down the leg, I'm going to discontinue this position. If it just feels like there's a pinch in my low back, I'm cool with keep going. From here, we're going to progress it and we're going to come into more of a press-up position. A lot of people want to squeeze their cheeks or feel like they should crack a nut between their butt cheeks in this position. Our biggest thing is just making sure that we are relaxed. You're going to come up, come down. You're going to repeat this for 20 repetitions and then check to make sure that your sciatic pain is not getting worse. If your sciatica pain is getting worse, there is another option for you. What we can do is go into more of a flex position. So your flex positions are going to be something more like your child's pose or a sideline opener. My personal favorite during this one is going to be more of a sideline opener. So what that's going to look like is the side of your sciatic pain is going to go up. What we're going to do, we're just going to lay on our side here. Legs are going to drape over the top, and I'm reaching forward a bit. What I don't want to do is reach over the top or bend backwards so there's a twist in my low back. I am trying to flex the spine to give a little bit more room for that nerve to come through. So if you find that this position is the position that works best for you, what you're going to do, you're going to hold it for 30 seconds. Bring the legs back up, and then drop for another 30 seconds. Another position that we can do if flexion seems to be the best for you is go into more of a child's pose position. So what that would look like here is we're going to come onto hands or forearms and knees. We're going to come here. I like to personally go palms on the forehead. And then we're going to breathe into this position here. As we breathe in, what we're trying to do is make our breath go into our front pockets here. Those two positions are the most common positions that I see that are helpful with my patients that come in with sciatica. They help to get rid of pain, but they aren't going to give you that long-lasting relief typically. You do have to back it with things like exercise. If you are dealing with sciatic pain, make sure that you do see a medical professional and get everything figured out, but go ahead and give these ones a try.